Hey girls, Unnies here. Quick question, what does a heart attack feel like? For men, it's usually crushing chest pain. For women, it might be nausea, fatigue, or shortness of breath. Same disease, completely different warning signs. Today, we're diving into a research papers on gender differences in cardiovascular disease. I'll break it down step by step, showing how men and women experience heart disease differently, from risk factors to diagnosis to treatment and even outcomes. Introduction and background. Cardiovascular disease is the #1 cause of death worldwide. About 1 in 3 deaths is due to it, and most of those are from heart attacks and strokes. Risk factors? Smoking, obesity, diabetes, high blood pressure, and cholesterol. Review, history of research. For decades, most heart studies were male only. Women were left out of clinical trials, so treatments were designed for men. Only in the past 20 years have researchers tried to correct this, but progress is still uneven. Prevalence and presentation. Men get more coronary heart disease, but women have more strokes. Women also show very different symptoms, like fatigue, nausea, or dizziness, instead of sharp chest pain. This often leads to misdiagnosis. Blood pressure is a big issue in older women, especially Black women, and heart failure looks different too. Women more often get HFpEF, men more often HFrEF. Let's explore how women's risks and outcomes differ from men's. 1. Biological factors. Women also tend to have smaller hearts and blood vessels, which means when they need surgery or procedures, their risk of complications is higher. Estrogen protects women before menopause by improving cholesterol, but this protection drops after menopause, raising risk. Men don't have a sudden change, but testosterone slowly declines with age. 2. Lifestyle factors. Smoking, diabetes, and high triglycerides are more harmful in women. Hypertension and high LDL affect both men and women. 3. Traditional risk factors. High blood pressure and cholesterol hit men harder, but smoking and diabetes hit women harder. Same behavior, different level of damage. For women, unique factors like pregnancy complications, polycystic ovary syndrome, autoimmune diseases, and even social and psychological stress play a big role. 4. Diagnostic differences. Tests aren't equally accurate. Exercise ECGs often give false results in women. Imaging like SPECT scans sometimes miss disease because women have smaller hearts or breast tissue interference. This makes women's heart disease harder to catch early. 5. Gender bias in care. Women are underrepresented in trials, diagnosed later, and receive less preventive care or rehab than men. 6. Treatment differences. Meds like statins, aspirin, and beta blockers work in both sexes, but women often receive them less. Surgeries like stents and bypasses also work, but women face more bleeding and complications. In advanced therapies like heart transplants, women are referred less often, and overall, their care is less aggressive. Outcomes and prognosis. So, what's the result? Women are diagnosed later, treated less aggressively, and as a result, they have higher rates of complications and death. In emergencies like cardiac arrest, women have lower survival rates and worse neurologic outcomes than men. Conclusions. The key takeaway? Men and women are not the same when it comes to heart disease. Symptoms, risks, diagnosis, and treatment all differ. That's why we need gender-specific strategies for prevention, diagnosis, and treatment. Thanks for reading with me. Hope this helps. Unnie's got you!